Joining us now with safe social distancing here at the SEC TV studios is Linda Barnhart, and she's a retired nurse. And you have an amazing story to tell us about some of the things you've been doing for the last couple of months here, 4 or 5 months, and how you brought together strangers and how that you've been able to make thousands of masks, scrub caps, and also headbands and stuff. And you're getting those to the front lines of the pandemic, and amazing. So I was glad to have you come on the show, so thank you for being with us.
Yeah, thanks, Jody. Yeah, it's been a really fun gathering that I've had with pulling people together, and it started in April. I was in Florida and came back from Florida, and there was this great need that I could see around making masks. And I knew I'm on the board of directors for Nexus Family Healing, and it's a mental health residential treatment program, and they have a lot of foster families. And I thought about this as a nurse. I thought they may need some masks because I knew PPE was not available.
Right.
And so as a result, I contacted them and I said, I can probably make some masks for you if you need to. That's how it all started. So I made 50 masks for them. They picked those up from my house and got those out to their foster families.
With no contact, right? You just had them on the doorstep?
I just put them out on my doorstep and they would come and get them. And then as a result, it came that my daughter-in-law's sister works for Dakota County, and she's just down the street, and she was telling me how they had such a need for their foster families. And as a result from that, she was pulling fabric in and elastic in on drives, and I was getting those. She'd drop them off on my doorstep, and I would make masks. So I couldn't keep up with it, so I put a request out on Nextdoor in Woodbury, and I said, I need SOAS to help me. And donations, we were running out of elastic, and as a result, I got probably up to 65 volunteers.
Incredible.
And probably about, I think it's
People
about
you
12
never knew
SOAS.
Before this?
No, a couple of them I knew, but it was mainly people that just wanted to help in some fashion. And just like me as a past nurse, I wanted to give back in some fashion too, that I knew there was a need. There was a real shortage of PPE. We didn't want to take the PPE that's needed for the hospitals at the front line. And so how could we help? And that's how we started that out.
And it grew from there. You said
Yes.
that it went to some of the other places. And
Yes, so it's gone to Nexus Family Healing, as I talked about, and that's in 4 states, but most of it came here in Minnesota. Pride Institute out on the west side of the Twin Cities. It's gone Washington County, Dakota County, Health Partners Hospice. There's been nurses that have contacted me directly there. M Health, most of the hospitals on the east side with M Health. Yeah, and Children's
You
United.
brought some examples too of what you were doing. So.
Yes, so here are scrub caps that I've made, and we've made probably 65, 70, 75 scrub caps. A lot of these have gone to nurses that they use themselves and wash themselves. United Mother-Baby, Hospice, they want to make sure that they cover their heads really good. So this is made by Anderson Corporation. They partnered with me to make 1,500 of these specifically. And they would make them. They got the fabric from Affinity here in White Bear Lake for quilting. And they put these together and just took their corporation, one of their plants, and did this for a while. And I distributed 1,500 of these for them. And then these are just the little masks, the little girls' masks that we had made, or little kids' masks. Some of these have gone to Children's Hospital. And this is the basic mask that we make for that we give out. And what I had done was I put kits together, and I'd have one piece of fabric of one kind and another piece, and then 4 pieces of 6-inch elastic. And I'd put these in kits of 50, put them in bags on my step, and individuals would come and pick them up, and they'd sew them, they'd bring them back and drop them off, and then I would distribute them.
Oh my gosh, that is incredible. And you said that you've distributed over 5,500 of these various things? And
well, 5,500 masks. I think we've done 70, 75 or so scrub caps. We have distributed, I think there's also a headband that we have here that we put the little buttons on, and we just hand sew these on. And these are for nurses also, that it prevents them from having their ears break down. And actually, I have nurses from my specific clinic that are texting me just to get these personally, and we just make those for them yet, and so probably done about 50 to 100 of those too.
Incredible.
Yeah.
That's just amazing. And you're kind of coming to a close now, you were saying. That
Yes, we are. Everybody was very, very active with this. I probably had about 6 SOAs that were extremely active. And as people are starting to go back to work, kids are going to school. We had some kids that even helped us cut, and grandchildren. And so it's a really sweet kind of thing that was going on with it. And they, as they're going back to school and going back to work, it seems like it's kind of slowing down. And also what I found is that the elastic that we make homemade, these worked really good when we first did this in March and April, because there was such a need and they weren't available. And now the industrial masks are out and people can get those and buy them at the different stores and that. And I think they last a little bit longer. This elastic doesn't last as long. And so we're kind of slowing down with it. I'm still have some that would do it if we wanted to, but we'll kind of see how it goes. But we are slowing down.
What an incredible project, and that
Thanks,
you
Jody.
gave of your time, and
Yeah.
probably save some lives and protect our healthcare workers and stuff.
Well, we're just really happy that we were able to help, because one of the rules that we had with it was that it had to go to nonprofits. It wasn't that somebody could buy a bunch of masks from us. This is for nonprofits that really needed it at the time. Foster families, mental health, residents, those kinds of things that really needed this help. And there was a great need. There continues to be a great need for this, but then it felt very good.
Just
Thank
amazing,
you.
just amazing. I just
Thank you.
can't say enough about it. And thank you for doing this, and thank you to all of your army of volunteers, sewers, and thank you to them as well. So
Yeah, thank you, Jody.
Pleasure.
Appreciate being here today.
pleasure to have you on our show. Thanks,
Thank you.
Linda.
Yep, you're